I take you as my wife or husband, to have and to hold from this day forward, in richer for poorer, in sickness, in health, to love and to cherish, till death do apart. But do people really mean this marriage vow till the end? What if their need ain't fulfilled? Does the marriage crumbles? I have seen couples fighting in the counseling room just because of stoma. Please stay tuned with the video to see how you can do love making with the stoma. So many of the ostomates have this doubt or have this query in their mind that will they reach the finish line? Will my partner have the desire with me? Is the effluent contagious? What if I get pregnant during the act? Will it be painful? So you need to do the sexual assessment for yourself before. Are you sexually active? Do you think your ostomy will affect your sexual activity? Have you discussed your concerns with your partner? Have you ever noticed any changes in your sexual activity? Have you had any problems with sexual performance, erection, ejaculation, vaginal lubricants or pain with intercourse? Do perform this sexual assessment before you act. So are you thinking, is sex and intimacy there beyond the pouch? The answer to it is yes. So according to a famous psychiatrist, Celio, he says that an ostomy may feel like a wrench in your romantic dreams, but with proper communication and planning, you can have a rich and satisfying sex life. So if you are thinking about having a safe sex, think about it emotionally as well. So first point is talk to your partner, spouse about the stoma. So you need to know about your boundaries in the sex. You need to express your feelings. Say that you're okay with something and say if you're not okay with something as well. Having sex with the person become dangerous if the sex is not safe. So have clear and precise communication as well. It is a part of a healthy relationship. Don't sleep with your ex-partner just because you didn't find a new one who would understand about your stoma. Don't be in a negative kind of a relationship. Guard your physical, emotional and sexual desirability as well. So practice both implying the consent. Consent is a very mandatory thing for any sexual encounter, whether it is the first time or you're sleeping with someone or it is your husband or your wife. Even if you're married for 2-3 decades, consent is very, very important. Practice safe sex, use protective devices like condom. Having stoma doesn't mean that you are prohibited from sexually transmitted diseases. So do practice safe sex. So before any of the sexual activity, you need to understand or evaluate for the sexual dysfunction as well. So as an ostomate, ask yourself that are you having any of the issues with sex or intimacy? So and female sexual dysfunction inventory evaluates the desire, arousal, orgasm, vaginal dryness, pain during the sex. So what are the most common physical problems which is experienced in both men and women? These are the skin irritation, rashes, surgical scars, sleep disturbances, gas and bad breath, that is halitosis. So what are the common problems which are experienced by men? Constipation and diarrhea and erectile dysfunction, and whereas the woman experiences pain and vaginal dryness. Well, the first physical problem which is noticed by both of them is constipation. What is constipation? If a stoma fails to function for more than hours, if you experience cramping, swelling in the abdomen and liquid stools, and constipation can be a possibility that your colon is absolutely functioning. So how can you treat this constipation? Increase your fluid intake, exercise, a good amount of physical activity can help treat the constipation. Have an adequate intake of the fiber, as well as the patients with colostomy, they can go in for irrigation. So irrigation helps establish a pattern of elimination in treating the constipation. Likewise, if a patient is having diarrhea means if there is an increase in volume with more liquid consistency, more emptying of the pouch is noticed, and the presence of cramping, dizziness as well as decreased urine output. If these symptoms are noticed, you need to treat the diarrhea. Increase the fluids, dietary manipulation, that is more carbohydrate and fiber intake may help. Loperamide tablet, low motil, that can decrease the bowel activity, and in case of severe dehydration you need to consult a physician. Very frequently observed physical problem is pain, which the woman experience more due to dyspareunia, vaginismus and vulvodynia. 40% of the postmenopausal women have symptoms of urogenital atrophy as well. So how can you treat this pain? You can go in for local estrogen therapy, vaginal rings, creams and tablets, any pelvic floor physical therapy, which can resolve the symptoms up to 80 to 90% of the patients. Vaginal dryness is another problem which is experienced by women who have radiation therapy for low rectal cancer or somewhere in the pelvis. It causes scarring and damage to the pelvic organs as well as fibrosis of the pelvic tissues. So how to treat the vaginal dryness? You need to use vaginal dilators to keep the tissue elastic. Use of octreotide and other drugs can affect the vaginal canal. Try hormonal creams or water-based lubricants, vaginal suppositories that can heal the place, and consult physician in case of any adverse effect. So these are the sizes of the vaginal dilators. So in case of APR as well, where the lower rectum and the anus is removed and the bottom is stitched closed and the result is colostomy or stoma, the patients can have this vaginal dryness issue. So in case of an ileal conduit surgery, where a gentleman who had a cystoprostatectomy where both bladder and prostate has been removed completely, and the surgeon tried to do a nerve sparing operation where you can retain the nerve endings and the sensation in the pelvis, and sometimes when it is not possible, removing the prostate and often result in the loss of nerve function, erectile dysfunction can take place. So erectile dysfunction is nothing but the inability to develop and maintain a full erection. The cause of it may be psychological due to stress, performance anxiety and depression. So how to treat this erectile dysfunction? No ostomy surgery rules out the possibility of the orgasm. Some may interfere with the erection, ejaculation and fertility. There are available local oral agents like sildenafil and vardenafil, etc. You can have it. Consult a urologist to decide whether this problem is from anxiety or surgical damage. So these are the measures for the sexual dysfunction. First is for the men, penile implants to treat refractory sexual dysfunction for the erectile dysfunction. Second is for the women, especially pelvic floor therapy as well as the Kegels exercise. They help to treat the pain for the sex, improves the genital blood flow following the pelvic surgery. Third is the vacuum suction device, where in the sensation, deep vaginal lubrication, ability to orgasm and overall sex satisfaction, this can be developed. Now we are done with the physical problems. Next we'll deal with the emotional problems. The first emotional problem experienced is fear. What if my stoma gets rowdy and shit on my partner? So there are various solutions available in the market, like accessories, bells and wraps to cover the stoma while performing this act. So how can you overcome the fear, or how can you prevent fear from happening? First is blindfold your partner. Make your partner comfortable during the act. Make it comfortable with or without the clothes. Use ostomy innerwears, lingerie, anything which wraps around the middle section of the stoma. Exhibit confidence during the act. How can you exhibit? Educate your partner regarding the stoma, that it's not going to be harmful. Grow in your new self. Accept yourself with your stoma. Ease out the freaking fears that you have. Practice before you act. Practice makes man perfect. We have heard it before many times. So accept your new scars with a new beginning, and worry is directly proportional to fear. So thus these products are really helpful, like ostomy support garments, crotchless briefs, high camisole, tight fitting clothes, waistbands, intimacy wraps, hernia fitting support belts. You can go and have a look for these products at xt.com as well as Ostomates, My Secrets. You can experiment with your partner. Another emotional problem is leak. What if the pouch bursts or leaks? So how to overcome this leakage issue? Empty the pouch and flap the pouch up before the act. Secure it with a tape or tie a cloth around the apron. Don't empty the pouch in middle of the act, that can hinder the feelings. Odor is something which is experienced in the day-to-day activities of the ostomates. So what if it occurs during the act, or how to prevent it before the act? So most offensive topic of to talk about, ostomates and their partner experience this issue very often. So how to control the odor? Avoid the gaseous foods, use good amount of scent and perfumes, empty and clean the pouch before the act, or change to a new pouch. Next we talk about the positions. So if you are experiencing difficulty in certain positions, feel free to try out different positions. Sometimes positional change can change the direction of the vaginal canal and it can relieve some of the discomforts. So feel free to experiment these different positions, and of course the pain and discomfort becomes severe. Do not continue because you feel that you have certainly need to stop and try for another one and feel comfortable, right, and safe for yourself. So these are the certain positions which I am going to deal with. There are certain positions in the pouch in which the pouch is not going to flap or move around. Try for positions where the pouch is not visible to the partner, and use for support garments to camouflage the stoma. So these positions help the patients with stoma and catheter. Firstly, the spoon. Next is the standing on the edge of the bed. Third is the behind position. There's missionary position and brace position. So the spoon position looks like this. In this way you can hide the stoma as well as the catheter, and both are secure in this way. Standing on the edge of the bed, behind position, brace position. So whereas I need to tell you about the missionary position, in this position there can be some sort of apprehension to the one who is on the top because the pouch is going to be visible. So an opaque pouch would do the needful instead of a visible one. So the next best position is side lying position. There can be less movement of the pouch, and lay in the non-back side to prevent the squashing of the pouch, and before the act just empty the pouch. So what you need to keep in mind before the activity, there's some kind of preparatory activity which one needs to do before the lovemaking scene. Turn off the lights, that is to discreet the stoma. Clean yourself. Bathing is very important. We know its importance as well in our day-to-day activities. Empty the pouch or put a new one. In case of an end colostomy, do a colonic irrigation. Use deodorants and eau-de-cologne perfumes for the stoma, or Listerine for a strong good smell. Therefore, never use the stoma for penetration. Stoma, we all know, doesn't have the nerve ending, so we need not use it. Lubricants can combat vaginal tiredness. I have already spoken about the water-based lubricants as well. Pain can be caused due to the uterus shifting. You need to try different positions for that. Try different accessories as well, and design bags that can help with the intimate movements. So what did we learn in general video is that we need to connect with certain ostomy support groups who can help. Talk about your issues, control your mood and feelings and emotions. You need to talk about it to your partner as well. Use a good deodorizer, address the physical issue, and flip the script. Whenever you are in a bad or sad moment, flip the script, like change the topic. There was a research article which was based on marital interaction in partners of ostomized patients. So the objective of the research was to investigate the socio-demographic profile of the ostomized patient, describe their daily marital interactions, and identify this individual's health demands. So the method used for this research was descriptive and quantitative study. The group of the patients were 36 partners. It appeared that everybody overcome the barriers imposed by their partner conditions. This research article concluded with the changes following the stoma surgery also had an impact on the patient's partners, and both the individuals must work together to keep it a secret if necessary. The respondents also empathized with their partners, agreed that undergoing stoma surgery is a difficult ordeal. Always remember that intimacy is a lot more than sex. Intimacy is not restricted with ostomy. Stoma will not affect your ability to have sexual intercourse with your partner. Remember that sex isn't only what happens between your legs, but it is also what's going on in your head. So your partner is irreplaceable. So do not lose your partner on the basis of stoma, or do not lose your partner on the basis of having a new phase in their life. This poem is just for you. Days go quiet and disappear, darkness know the truth. I fear, I swear to God, I swear in vain, alone with all my pain, only to give you a sweet beginning. But no matter how hard I try, I find myself on the losing end. Of all the trouble I had in life, you're missing and I'm haunted. You're broken but I'm fearless. Are you listening? 'Cause you're wanted. You have spoken and I have heard. Many people with ostomy surgeries feel they are unlovable, and this is totally understandable due to the physical and the emotional changes they have undergone. But true and genuine love can overcome all of this. If you like this video, please do like, share and subscribe to my channel. Stay blessed.